Okay, YouTube, I'm back. I promised to be vulnerable with my own healing journey, and so I'm here answering questions that people ask me about my own therapy. So, this question really intrigued me. Do I act like a typical client coming in to another therapist, or is it somehow different because I also am a therapist? And I think the truth is that I act exactly the same or very similar to anybody who comes in. I'll give you an example. So, um, it'll happen sometimes when I'm working with somebody and they've gotten a diagnosis that a few sessions and they'll come and they'll be like, hey, turns out I think you're great, but it turns out I saw this TikTok and I don't in fact have this diagnosis that you thought I did. And we'll talk a little bit about why is that important to you and is there something about the diagnosis that's troubling, those things. But I'll invite them, hey, let's pull up that TikTok, let's go through it together, and I'll explain to you why I think what I think and instead of what TikTok thinks. And so we'll go through it together, and at the end I usually will ask, hey, what do you think about that? Do you think that um, maybe you do in fact have this mental health struggle? And so that's how that goes. And so with me, I just up the game a little bit, right? Because I'm trained in this, like I'm pretty smart. So instead of TikTok, I use other things. So I'll just give you an example of a session a couple weeks ago. I came in and I was so excited. I was like, hey, I know I already paid for this session and I don't want to waste your time, but I'm really excited to tell you I don't actually have PTSD. Isn't that great? And you can imagine they were probably confused a little bit. Like, oh, okay, what happened? And I was like, look, I happen to be going through our DSM, and it turns out that I don't experience criteria D number 5. So that means that I don't have this struggle that we thought I did, and so we're done here, and I can just carry on. I might have went through some hard things, but I think I did. I survived it, and I'm okay. The DSM said. And so, what do you think she did? Do you think she was like, oh, that's great news, Em. I'm so happy for you that you, in fact, do not have to heal from this stuff. Great job. Reminded me about that part of the DSM. It's not. It's not what she said. Unfortunately for me, that's not what happened. She was like, oh, seems like you have some feelings about this possible diagnosis. Do you want to go through a diagnostic together? So she invited me into the process, just the same as I do with the TikTok, right? Let's go through it together. So we went through some questions and she did a whole diagnostic. And at the end, can you guess what might have happened? Do you think she was like, turns out you were right. Thank you. I missed that D number 4 or whatever number I said. It's not what happened. What happened was just like, turns out you do actually meet the criteria in the DSM for chronic trauma. How do you feel about that? I didn't like it. I didn't feel good about it. I wasn't happy. I really wanted to be off the hook of the healing. It's just part of how avoidance works, right? Like we start to do the work and then we panic, right? Like, oh, wait a minute, this is hard and it's a lot, and maybe I don't in fact have this struggle that I in fact have. So no, I'm no different than any other human who realizes that their mental health struggles are impacting their ability to function at the way that they want to, and I have to do all of the same work, including going through those stages of maybe I don't actually have that, and coming to the realization that I do and it's okay, and that I can make the choice to try to heal from it, or I can continue to pretend I don't have it, or continue to deny that it's a thing for me. So I'm the same as you. So ask questions in the comments, give my therapist some kudos for putting up with me, because I promise you, y'all are great compared to how I am as a client. I would not like me as a client. So maybe give her some hype man talk, right? And ask some more questions in the comment. I'm not usually this vulnerable and honest about my own struggle.